The fourth part of our revision today is about the fourth bone of the upper limb, which is the radius. The radius is one of the two long bones in the forearm. It is the lateral bone of the forearm. This is the head of the radius. This is neck of the radius. This is the radial tuberosity. This is just the shaft. On the anterior aspect, we have the oblique line. The medial border of the radius contains this sharp interosseous border. This is the lower broad end of the radius, which is smooth anteriorly and rough and containing the dorsal tubercle posteriorly. This is what we call the styloid process of radius. Identifying the side of the radius, as we can see, you should put the head of radius above, the interosseous border medially, the smooth anterior aspect of the lower end anteriorly. So the head above, the interosseous border medially, and the smooth surface of the lower end anteriorly. This is a right radius. This is a right radius. As for the articulation, the radius articulates by the head with the capitulum of the humerus, forming the elbow joint, which is a hinge synovial joint. The radius articulates by the lower end with the scaphoid and leonate sharing in the wrist joint. It forms three articulations or three joints with the ulna: the superior radioulnar joint and the inferior radioulnar joint, or the proximal and distal radioulnar joints, which are pivot synovial joints, responsible for the movement of supination and pronation. The interosseous border attached to the interosseous membrane between the radius and ulna, which is a fibrous type of joint, exactly fibrous of syndesmosis. As for the muscle attachments, first we have the tendon of biceps. Tendon of the biceps muscle is inserted in the radial tuberosity. The oblique line is the site of attachment of the flexor digitorum superficialis. The front of the shaft, we have the attachment of the flexor pollicis longus muscle. The lower end of the shaft, we have the attachment of the pronator quadratus muscle. Pronator quadratus. On the lateral aspect, the upper part of the shaft, starting above the oblique line and surrounding the whole upper end, on the lateral aspect to posterior aspect, this is the attachment of the supinator muscle. The mark exactly in the midshaft in the lateral aspect is for the pronator teres muscle. The muscle attached exactly at the styloid process is the brachioradialis muscle. So on the lateral aspect we have three marks: the supinator, the pronator teres, and the brachioradialis. On the back of the radius, there are two muscles attached to the back of the radius. The first muscle in the upper half of the shaft is the abductor pollicis longus. The abductor pollicis longus. The second muscle attached to the lower half of the shaft is the extensor pollicis brevis. Extensor pollicis brevis. Thank you for watching the revision of the radius.